again. Hi, my name is Olivia. I'm going to be your student nurse. Can you tell me what your name and your date of birth is?
Belinda Crittenden, 1/15/89.
Okay. We're going to do a head-to-toe physical assessment today, and I'm going to get started with your scalp and your head and your face. We're going to inspect for any lesions or infestations. There are no lesions or infestations. Next, I'm going to palpate your sinuses. Let me know if there's any pain or sensitivity. We're going to do your frontal and your maxillary. Was there any pain?
No.
Next thing I'm going to do is palpate your auricles, which are your ears. Let me know if there's any pain.
No.
Okay. Next, I'm going to make sure there are no lesions or abnormalities, no discharge or blockage. There are no lesions, no discharge, no blockage or abnormalities. Next, I'm going to check your eyes. Your eyes and your eyebrows are symmetrical to your face. Next, I'm going to have you look up so that I can look at your conjunctiva. They are pink and moist. Now look down and I'm going to look at your sclera. And they are white and moist. Okay, next we're going to see if your pupils react to light. Your pupils do react to light. They are round. Can you follow my pen light for me? Okay. Next I'm going to have you look at my light and then look at the wall behind me. Then look back at my light. Your pupils are round, reactive to light, and accommodating. Next thing I'm going to do is inspect your nose. If you could look up just a little bit, I'm going to make sure that your septum is midline and there are no deviations, which there are not. Your mucous membranes are moist. Can you flare your nostrils for me? Okay, your nostrils flare symmetrically. Next I'm going to check for patency. I'm going to close one nostril and I want you to sniff and then the other. Okay, they appear to be clear. Now I'm going to inspect your mouth. If you could lift up your tongue. Okay, go side to side, up and down, and say ah.
Ah.
Okay. Your tongue is pink and moist. Your gums are pink and moist. Your mucous membranes are pink and moist. Your teeth are white and in line. Your lips are smooth, pink, and moist without any lesions. Your palate has no lesions. And your tonsils and uvula are intact. Next, I'm going to inspect your neck. If you could lift up just a little bit for me. Okay, your trachea is midline and your thyroid gland isn't enlarged. Next, I'm going to auscultate your carotid arteries. Okay, they're free of bruits. If you had any bruits, then it would indicate blockages of the vessels, but you do not. I'm going to inspect and palpate your skin on your interior thorax to make sure that your skin is consistent with the rest of your body. Also, I'm looking to see if there are any lesions or edema, which there is none. I'm going to check your temperature and make sure that I don't feel any moisture, which I do not. I notice you're not using any of your accessory muscles to breathe. And now I'm going to auscultate your lungs, and there are 8 spots, so just breathe normally for me. Okay, and they're clear from any crackles or rhonchi. Next thing I'm going to do is I'm just going to put my hands on your chest. I want you to take a deep breath for me, please. Okay. Your lungs rise and fall symmetrically. So I'm going to teach you about a breast exam. Do you do a breast exam monthly?
No.
Okay, well it's good that you do, especially if you do have breast cancer that runs in your family, and just pick any day that you'll remember of the month. So lift up your hand, put it above your head. You start at your axillary muscle, which is also your armpit. And you go in a circular motion around your breast until you get to the nipple. And then when you get to the nipple, you squeeze to see if there any discharge. If you notice any discharge or lumps, then you need to call your physician immediately because You just need to. Okay, next I'm going to inspect your cardiac cavity, which is where your heart is. You can find that between your second and your fifth intercostal space. First I'm going to palpate, see if there's any visual pulsations, which there is none. There are also no thrills. I'm going to go ahead and auscultate your heart and your valves on the right side of your sternum and between the second intercostal space is your aortic. Left of the sternum in your second intercostal space is the pulmonic. Left in the third intercostal space are your herbs. Left of the sternum in the fourth are your tricuspid, and in between your fourth and the fifth is your apical pulse, which has sounded clear from any murmurs or dysrhythmias. Next is your posterior thorax that we're going to do. And I'm going to inspect your skin to make sure it's consistent with the rest of your body, which appears to be consistent. Next, I'm just going to let you take a deep breath. You can exhale. Okay, your lungs rise and fall symmetrically, and I'm going to check your spine to make sure there's not any scoliosis or kyphosis, which you don't. Then I'm going to auscultate your lungs in the 10 fields of the posterior thorax, and once I get to the bottom, I'm going to go over to the right side so I can hear the last one. Okay, it sounded pretty clear from any crackles or rhonchi. I'm going to inspect and palpate your upper extremities. So I'm just going to look at both your hands and check and make sure, and your arms, to make sure there's no lesions or edema, which I do not see any lesions or edema. I'm also checking your tent to make sure I don't feel any moisture, which I don't. Your skin is consistent with the rest of your body. Now I'm going to take your pulse, your radial, and your brachial. You can go ahead and do it on both sides. And they are bilaterally symmetrical, which is good. Now I'm going to check your capillary refills. So I'm just going to push on your fingernails a little bit. They are both less than 3 seconds. So I'm going to check your fingernails again, make sure there's no clubbing, which they are free from clubbing. So I'm going to check your tugger, which I can do on your forearm or your upper arm. Okay, and it appears to be free of any tenting, which is good. So I'm going to check your strength. So if you can raise your arms up. Okay, to push up, push down. Okay, those are good. And I'm going to check your range of motion. So if you could copy me, please. Can you do flexion and extension, abduction, and adduction? Okay. Next, I'm going to check your abdomen. So if you could just lay flat for me. Okay, if you could just take a deep breath, inhale and exhale. Okay, your stomach rose and fell symmetrically. It seems to be flat and smooth. I don't see any masses or enlargements. So next, I'm going to oscillate your 4 quadrants. So I'm just going to listen here for a minute. Listen to see if there's any hyperactivity or hypoactivity or any absent vowel sounds or even normal ones. Okay, and I heard vowel sounds in every quadrant. If I wouldn't have, I would have listened for up to 5 minutes in each quadrant, but everything was normal, so I don't have to. There's no hyperactivity, no hypoactivity, or abnormalities. Next, I'm going to palpate each quadrant to make sure that I don't feel any masses or enlargements. Which I don't feel any masses or enlargements. So I'm just going to check your skin. Okay, all that looks good. Now I'm going to move to your legs and your feet. I'm going to check your skin again to make sure it's consistent with the rest of your body. which it is. It's free of any lesions and edema. I'm also checking your temperature to make sure it is the same as the rest of your body and it's free of moisture. I'm also going to check your posterior tibial pulse and your dorsalis pedis pulse. Okay, they are both bilaterally symmetrical. And next I'm going to check your capillary refills. They are both less than 3 seconds. I'm checking for clubbing down your toenails too. There are none. Now I'm going to check your strength. If you could push up for me. Okay, and now push down. Okay, good deal. Now I'm going to check your range of motion. We're going to do flexion, extension, abduction, and adduction. Now we're going to go ahead and do it on the other leg. Flexion, extension, abduction, and adduction. Okay, those are all within normal limits. You can sit up now. Okay, well thank you for letting me do my head to toe assessment on you. You can get your shoes on because we are now finished.